Hi everybody, this is episode 3 of Rehab with CEO, and this one's going to be on the abdomen and back. And I'm really excited to do this video with you because abdomen's probably my most favourite area of the body. I really like working people's jaws and working their feet, but definitely abdomen is by far and away my most favourite. Pretty much everyone who comes to see me near enough is going to get their tummy poked at some point and coming to see me. I just find it such an interesting part of the body, and there's so many problems manifest from the abdominal area that people don't appreciate, and a lot of people wonder why I poke their tummy when they have a sore back, and I'll hopefully some anatomy stuff later on will explain that a bit further to you. But yeah, I can pretty much state that most people that come to see me with a back problem, it's usually especially if it's a lower back problem, not all, but a high number of people I treat, their abdomen is usually causing the problem, or their hip flexors. But yeah, I just find the abdomen region really, really fascinating. So I hope by the end of this video you guys will be as excited about abdomens as I am. A little bit of massage geekery there, but yeah, I just find it so fascinating because so many things can go wrong with it, but people don't appreciate that that's actually what the problem is. They think it's something else. So it's kind of going back to that whole, this is where I have pain in this X region, but it's actually Y, the Y or Z part of the body that's causing it. So abdomens are really bad for masking problems in other places. So that's why I get so excited about it, because it can be really enlightening for people to realise where their pain is coming from. So like before, we've got Sid deconstructed for some anatomy, and today's gadgets and gizmos that we're going to use are your trusty teaspoon again, and your Franklin ball, foam roller, or your big rolled up bath towel, and last but not least, my favourite Shakti mat. Not endorsed by anybody, I just really love this, so if you've got a spare bit of cash lying about, get yourself a Shakti mat. I absolutely love it, it's so good. You can use it for so many different things, but we'll come to all that stuff later. So, abdomens and back. Trusty Sid here to help us with this. Please remember that your back is a 3D object, or your spine is a 3D object. I can't harp on enough about it. Like, people just think their back is their back, when it's not. It's got a posterior side, a lateral side on both sides, and an anterior side. And we just sit too much. So many problems with our backs, especially in the lumbar region, is all coming because we're sitting too much. We are not designed to sit or drive for the amount of time we are nowadays, and that's kind of quite bad for us whilst we're all self-isolating right now, because people are working from home at their kitchen table, their dining room table, and it's not designed to be worked on for the hours that we're working on. And so hopefully there's some nice little exercises here today that is going to help you whilst you're stuck at your home office that's not really designed as an office for you to work at, and you have some relief from doing some of these exercises. So people always ask me why I want to poke their tummy when they come to me for back pain, and I can almost guarantee you, when someone comes to me for their first appointment on really bad back pain, I'm not going to touch your back, which sounds really counterproductive, but generally the last thing people want you to do is when their back is really sore for you to poke it. So I tend to go away from the problem, and then gradually, as the appointments go on, we work closer to the problem. Now hopefully at that point their problem's a little bit better, and that's where you see the magic happening. So if we go back to the first video when I kind of spoke about if you bring the start end of a muscle closer to the end of the muscle, it gets short and it gets tight. Muscles work in pairs, so they kind of work like a seesaw. If you have one muscle where one end comes towards the other and it gets tight and short, the other side of that, as you go like this, on the other side it goes the other way and it gets too long. And that's what happens with so many back problems. And unfortunately, like I said before, Sid doesn't really move that well. But if you think about the amount of sitting we do, so legs are dangling off here. In fact, I can try and be a leg here. So this is me. I am Sid's leg. If we are sitting too much, what we have to remember is there are muscles on the front of the spine, just like when we discussed the neck. There are muscles on the front of your neck and in your throat. It's not just all about the back side of it. So when we sit too much and your leg comes closer to your body, this all gets really, really tight, and everything on the back here gets over lengthened. And what then tends to happen is, like, see, he doesn't move that great. Your pelvis comes forward or tucks under, and that tightens up further. So then when you go to get out of a chair, you're like, oh, I feel a bit stiff through my back. And that's because for all the hours that you were sitting, everything through here was being over lengthened and overworked and overstrained, and everything through here wasn't doing anything. It was on holiday for the amount of hours you were sitting. So suddenly when it has to activate, it's a bit like, no thanks, I was enjoying my holiday, I don't really want to do anything. So then this all has to work so much harder. And the amount of people that say to me in clinic, oh, I just put on a pair of socks and my back went. Oh, I just bent down for something and my back went. It didn't. I can absolutely promise you it did not just go on that one incident. For weeks before, you'll have been getting little signs with a bit more stiffness, a wee tweak here and there, giving you warning signals that something is about to happen. And the reason it's went on that extra little movement is because all through here was already so long from you sitting with the pelvis tucked under, that when you then try to go that little bit further, it just has no more length to give you, because this is already so short and so pulled round. There's no more space here to give you that further shortening here, and that's why it goes. And then when you start adding complications like pregnancy, abdominal surgeries, whether it's organ transplant, hysterectomy, appendix removal, gallbladder removal, these add so many further complications to the problem, because if you're already sitting and doing a lot of this, and then you add an incision, a surgery across here, and that gets further tightened. In addition to that, when you then go to try and stand up and you're a little bit stiff, there's still this extra stiffness here that you can't unravel because that's been surgically stitched. And that's going to pin you more. And again, people who come to see me in clinic know just how much I love working scars. Scars are fascinating. The biggest thing I want people to take away from this is scars should not be numb, or they shouldn't be as numb as when you first had a problem with it, like so you had the surgery or procedure. So if an area of your body is numb because you've had a surgery, it's not getting a good feedback, it's not getting a stimulus. Your brain doesn't know that part exists because it's numb. So get your teaspoon or your Franklin ball and do some work to that scar, especially if it's an abdominal scar, because you're just, by working through that, you're giving your back the best possible chance of not giving you grief later on. And like I said, I love poking scars on tummies, anywhere in the body, but tummy scars are really, really good. A big thing with abdomens is digestive problems as well. A lot of people coming to see me say, oh, I've got really bad IBS, and I always question it, and I think they think I'm being rude, and I don't mean to come across as being rude. It's just something I question a lot of, because to me it makes complete sense that if you're sitting compressed all the time, you've got to remember with Sid, when I show you guys these things, that this is literally just bare bones. You've got to remember, in this whole cavity, you've got blood vessels, lymphatics, nerves, muscles, and organs. There is not a lot of room in there for things to go wrong. So if you're sitting for 8 hours at your desk with that all compressed, is it any wonder you potentially have some IBS or some digestion problems going on? To me, that kind of makes sense, that if your whole digestion system is getting compressed, you're going to be more prone to burping and flatulence because things can't move along as well as what they should. And if suddenly you're a little bit more windy than what you would normally be, potentially it's actually your tummy's just a little bit tight. It's not what you've eaten. It's externally, it's what's compressing it to actually not allow your digestion system to work as effectively as it could. Because if everything's squashed, it can't break things down, it can't metabolize properly. The process of things moving through your digestion system is called peristalsis, and it's like a little wave motion. And if everything's compressed and squashed, there's not much room for that to happen. And I always find that when you do a lot of abdominal work with people in clinic who tend to have some GI issues, their GI issues settle quite a lot, and they get a little bit more relief, which is really, really nice. So I love abdominal work for so many reasons, but mostly for alleviating back pain. But it has some really nice outcomes for scar work, like I say, whether it's been a grumbly appendix or hysterectomy or cesarean section. Oh my goodness, cesarean sections, they're a necessity, but the havoc they can cause with people's bodies is not fun. And I love doing post-cesarean scar work with people. It's really interesting. So yeah, that's kind of like a brief run through of abdomens and how they can affect your back. So I can show you, I'm going to start showing you some stuff on how to fix this. As much as this is kind of like a back video, there's a couple of back exercises, but it is really more about trying to tackle these abdominals to give that length back to your abdominals, to take the pressure off your back. I'll do some more back stuff, maybe into the pelvis and upper leg video that's coming out next. But I do think it's a bit like working shoulders. If you release off someone's chest, their upper back and shoulders are just going to be so much happier, and it's kind of the same with the abdominals. So some of these little exercises I'm going to show you, they will help your back, but they are more abdominal targeted, and hopefully you can let me know whether you find them helpful, but I'd like to think you will, because they are really, really good. So go and get your teaspoon, and I'm going to put my top off to show you so you guys can see what's going on. None of these are going to feel that nice, I'm afraid. We all just sit too much, and what you're going to find is they're going to help your breathing too, because again, people forget that ribs are attached to spines, and if you have a back problem, you're going to have a rib problem, which can lead to a breathing problem, or if you have a rib problem, it can lead to a back problem. And yeah, it's just, they're all much of a muchness, they're all intertwined, so it's not just one thing in isolation. I have X problem. Actually, you have a few different things that's now giving you X, Y, Z. So let's start picking it apart to get rid of that. So I'll just put this t-shirt off so you guys can see a little bit better of what I'm going to do, and we're going to start working through some of these, and hopefully you find it helpful. So the first thing I'm going to show you how to do is to kind of start opening up a little bit into your diaphragm. So teaspoon, this flat end again with the handle, you kind of want to get onto the edge of your breastbone, so edge of your sternum, just that little end bit that's called your xiphoid process, or as a patient of mine likes to call it, an exiphoid process, which makes me laugh quite a lot. So this is a little bit massage geekery. So get on the edge of your xiphoid process, and just like what I showed you with the pec coming into shoulder, that little fanning technique, that's what we're going to do all the way through those rib angles and just try to start opening all that up, because we do too much of this sitting. So just on the edge there, you're just going to do some really nice fanning all the way down. You can just gently pull up on the ribs as well to create some space. So again, you're going to do this to both sides. And you can come all the way down and round. You go through that a couple of times if you wanted. Same on this side, you're just going to fan through and work all the way down. Kind of like how I've discussed with working the collarbones, body's quite like a little wiggle technique. So I'm going to show you with the thumb and then fingers, just to do a little bit more working through there. So again, you can sort of like hold up and in a little bit, and it's not going to be very pleasant, I'm afraid. All around ribs and diaphragm is never that fun. You'll find all these little horrible yucky myofascial adhesions, so yucky bits as I like to call them. And again, you're just going to give it a bit of a push up and in and wiggle all through that. Same on this side. And like I showed you with sit, if you can start opening out the ribs at the front, you're going to have a massive effect on the thoracic spine at the back. And then fingers, you can do both sides at the same time if you like. You almost want to imagine there's like a pen line right down your midline, and you're trying to like open it all out from there to create as much space as possible. It's just going to help your breathing a little bit, which is good for anyone who is doing a lot of running or sport at the moment to try and keep fit whilst they're self-isolating. That's all quite nice just to lift up through there. Then trusty Franklin bowl. Probably do this one lying down. You can do the teaspoon one and the rib mobilisations lying down too, or you can do it sitting up. It's not really, it doesn't really matter, but this one's quite nice to do lying down. So if I was lying down, you're just going to start again just off your Ziphoid process, and just a really nice gentle roll basically all through that abdominal cavity and through your ribs all the way down towards your pelvis. You can go in all directions with this, up and down, side to side, circles, diagonals, it doesn't really matter. I just need you to give this area a stimulus. If you do have any abdominal scarring, definitely get a little ball and your teaspoon on those. So if I had, say, a scar across here, based on the length of the scar, you want to work like an inch past it in either direction. So say it was a couple of inches long, you go an inch either side. If it was an inch thick, you want to go an inch above and below it and work that whole area, because if you have a scar, and this applies to any part of the body, if you have a scar, that tissue isn't behaving the same as healthy tissue, but it then starts affecting how healthy tissue behaves. So if you can start work through it to give it a better blood supply, to give it a stimulus so your brain remembers that that part is actually existing, it's going to help all the tissue, or the healthy tissue around it, settle a little bit and not be on such high alert, and start to work a little bit better with that scar tissue. So yeah, just do like your fanning technique, follow up with some Franklin ball stuff, and that's really, really, really nice for that. So to finish off sort of upper, like the rib work, what we can then do, you can either grab a bit of wax, again it depends on how dry your skin is, thumbs, again I would do this lying down, edge of sternum, thumbs or finger to be fair, I quite like thumbs, edge of sternum, and you're going to follow the line of the ribs, and what you're going to do is just go through that space. You will find what feels like little marbles in these spaces, and you'll think, oh, what's that? It's just little adhesions between the ribs. So you have, you're supposed to have spaces through all these ribs for these little intercostal muscles. And if you've potentially had been involved in contact sport or a road traffic collision, slip, trip, fall, anything like that, these little spaces start closing up. And what you want to do is try and open those back out. It'll massively help your breathing, it'll massively help with your digestion, but more importantly, if you are closed up here, remember this is all affecting through here, if you're having compression through there, it's going to start compressing these vertebrae further and potentially giving you some disc problems, some neural problems. So this is a great little technique. People don't like it when I do this in clinic, unfortunately, but the aftermath of what we do is really, really worthwhile. So I've got a couple of horrible little adhesions all around my tattoo, which doesn't surprise me. So again, if you are someone who has a lot of tattoos, you're probably going to have a little bit more adhesion, no matter where it is on the body and around that tattoo. So again, you can teaspoon or your Franklin ball and work through that. You can work that posterior to anteriorly, so back of ribs to front of ribs, or anterior, posterior, front of ribs to back of ribs. It doesn't really matter. If I'm in clinic, I tend to work anterior to posterior. Everyone's a bit different, but I really like rib work, especially if someone's had a really nasty, chesty, cough, flu-y type symptoms. It's really good for opening all that back out again to help with people's breathing and when they're feeling so tight and restricted. So that's quite a nice technique too. You can take it further up. You've got to remember that your first rib sits just below your collarbone. So this collarbone, first rib. So you can use that technique all the way up to here, then all the way down. You probably get to about rib 10. It'll be a bit more difficult for most people to find ribs 11 and 12, but you can go all through those visible ribs, and then you can work a little bit further up the top too. So I'm now just going to move this a little bit so you guys can see these moves I'm going to do with you. So these are some nice little openers to start getting abdominals moved out, and then which will then start opening to your back, and it's a really good way of just getting some blood flowing through there, because unfortunately discs in the spine don't really get a good blood supply. So giving them some nice little mobilisations just helps get them freed up a little bit. It's kind of like releasing your body's own version of WD-40 just to re-lubricate that and make sure everything is quite happy. So we'll start with a nice little easy one, Cobra, and we can do different variations on Cobra. So I might just, I'll just leave it. So you're going to lie flat on the floor. Make sure your feet are flat, not pointed. So, excuse me, lying on the floor, and you're going to come up into a press up position and just gently lift up. And what that's going to do is just do a really nice stretch through your abdominals, because we're just doing too much sitting. So just be aware that you might get some pinching in the lumbar spine, so that's just a bit too much for you. You can come down onto elbows instead. It depends on what I've been up to that day, whether I can do a full arm extension or if I have to come onto elbows. Just play it by ear and see what's comfiest for you. So you can hold that for up to a minute really. It depends on comfort levels and what your mobility allows for. But that's a really, really nice one for releasing through the abdominals. And what you can do once you've done a sort of what I call a 12 o'clock Cobra, you can come down and do a sort of slight rotation and come up through 11 o'clock, come back down and come up through 10 o'clock. I'll just come to the front and let you see it a bit better. So if we're doing a 12 o'clock Cobra, you can then do an 11 o'clock Cobra and a 10 o'clock Cobra, and then you can come back to the middle and come up. Don't work through it quite as fast as what I'm working through it. 1 o'clock and then 2 o'clock and then back to 12 o'clock. So you can maybe hold like a sort of 12 o'clock Cobra 20, 30, 40 seconds up to a minute, see what's comfortable for you, and then your 11 and 10, 1 and 2, maybe 10, 15 seconds, just play it by ear and see what's easiest for you to go through with, and the more you do it, the easier it'll get. You can hold it for a little bit longer, but only ever hold it to where you're comfiest. Don't push through any pain barriers or that. Just be careful. So once you've done some Cobra, we can then start opening through hip flexors, which get absolutely gubbed with sitting and driving. And there's a little variation on these that you can do as well. So if we're going to stretch left hip flexor, right leg comes forward. Again, back foot is flat. None of this, just nice flat foot. Nice and relaxed. And you basically just want to just gently lean forward. Again, this is all very mobility dependent and flexibility dependent, so hopefully the more you do this, the easier this gets. Again, comfort levels, you can, if you want, put a pillow under this knee. Sometimes my knee gets a bit sore doing this. So you can just put a little cushion under there just to protect it a little bit. Hold it 20, 30, 40 seconds to start with. You can build up to a minute. What you can then do, when you get a little bit better at it, is you can gently do a side bend and try and tap the ground. You can hold that 10, 20 seconds and then come back. Then you can do the other side. So for stretching right side, left foot comes forward, come into the lunge, hold it for as long as you feel you're able to hold it, and then you can do your little tap. Don't try that straight off the back. If you're prone to sitting a lot, that'll be quite difficult, that little reach. But the more you do it, you'll start to find it opens up quite well, and that's a really, really nice one for those who sit a lot. You'll find that'll be quite a good one for really low back into high pelvis, tightness and restriction. That's a really, really nice one for that. Once you've done some hip flexor and cobra, a nice little one to do, again, a couple of variations on this, is your QL. So I'll quickly show you this on sit. QL is a really underestimated muscle. I tend to do this as a dangle technique, not the technical term for it, when I'm working in clinic, where I'll dangle someone off the bed. And it's a really, really good one for back pain. So QL attaches from the edge of your pelvis onto these, not a technical term, sticky outy bits on your lower lumbar vertebrae, and also onto rib 12. So QL, top of pelvis to transverse process of vertebrae, and when we sit too much, this gets really, really short. So this is a lovely little technique for reopening all of that. So particularly good for those who sit a lot, those who drive a lot, pregnant ladies. This is a really nice one because when you are carrying all the weight of the pregnancy out the front, pelvis tends to tuck under. It puts a lot of strain through all this, and QL shortens, and that can be quite uncomfortable, and then you get issues with sciatic problems. So this is a nice little technique for opening that out. So you can just see the edge of my bed, hopefully in this video shot. So either on a unit, sofa, edge bed, whatever you've got lying about where you can lean into something, a chair, that works really well. So you can do like a low kneel position, a high kneel position, and then a high kneel with an extended leg. So let's just take it to the first step. So a low kneel position, if we're stretching the right side QL, hand comes on to the object that we're bending over. Right hand side stretch, right hand comes onto your head. And what you're going to do with the hand that's on the unit is just walk it along the object. And as you walk along the object, you're just going to gently bend into it. So I don't want you to slump into it. You want to imagine a puppet string on the top of your head pulling you up as you bend into it. And that'll just open all the way through all these ribs and all the way onto that top end of your pelvis. And that's a really, really lovely little stretch. Again, 20, 30, 40 seconds, see what's comfortable for you. And then you can hold it a little bit longer, up to a minute. Once it gets a little bit easier, just gently come out of it. Do the other side, then you can come into a high kneel position. Same thing, just a little bit of a deeper stretch. When you bend and walk your arm away. And then the other side. And if you want to make it a little bit more tricky, only once you've mastered the first two, have a nice straight leg out to the side and then same thing, and you just get a further deeper stretch into that area, and it starts coming up a little bit into your lat as well. We kind of discussed in the last video with shoulders, hands and arms about the strong interaction of lats to pelvis, so we're going to do another little foam roller to lats at the end of this, just to tackle this whole midsection to try and help with some freeing up of all that. Then foam roller or rolled up bath towel. Let's pop you off to the side, we'll use you in a minute. So if you don't have a foam roller, this is quite a nice little technique, is roll up a big bath towel, and you're just, like I say, you're just going to use it like a foam roller. You're just going to lie on it, and what it's just going to do is just gently lift you off the floor enough so that your hands can come onto your tummy, just off the edge of your ribs, and then you're just going to gently drop them off to the side. You probably won't feel an awful lot doing this, but it's just gently opening through that sternum, that diaphragm area, and just those lower ribs. And it's actually just quite nice to just lie there for a couple of minutes and let that open out. Then you can bring your hands back in, and then you can kind of bring them off to 90 degrees, and then that just moves the stretch a little bit further up and opens up those ribs a little bit more. Again, you can lie there for a couple of minutes if you like, and then bring your hands back in, and then you can bring them all the way overhead, and that just opens up a little bit further through that chain. When that gets a little bit easier, you can then straighten your legs out and do the same thing, and you just get a little bit of a deeper stretch as those abdominals stretch out a little bit further. And then just to quickly show you that on foam roller. So same thing, just make sure you're nice and supported, hands on edge ribs, and just let them drop out. It's a little bit more of a challenge on the foam roller because you just got that little bit more space between you and the ground. But try and keep your elbows on the floor. I mean, it's okay if your elbows are kind of levitating, but again, that's just a mobility issue, so and flexibility. So the better all these things become, the closer your elbows will get to the floor, and then you can bring them out at 90 degrees. And I find that one a little bit more difficult. I'm just not flexible enough through these areas, and it's something I definitely need to work on whilst I'm not working at the moment. And then hands back on ribs, and then stretch up and out. And it's just such a lovely technique for opening all through that. So you can give that a bash too. And then from there, like I say, you can work all through this lat. I know we covered it in the last video, but it's a really good one for pelvis connection. So if you're opening up all this tummy area, you might as well open up this too, because it's just going to help with all of that. So yeah, find that little, like I talked about in the last one, find that little meaty bit, lie on the roller. You can just lie there, and you can rotate with your arm. You can lift your arm up and down, you can swing it round and back, then you can start rolling through it, and that's just really, really nice too. Last couple of exercises now. This is a much nicer one after you followed through with the foam roller. So nice little lie on your back, arms out like a crucifix, feet together, and what you want to do is just drop your knees off to the side. Just nice and gentle, nice and slowly. And that's really nice for mobilising all those discs and getting those vertebrae moving a little bit better. What you might find is your shoulder might want to lift off as your knees drop. So if you're struggling with a bit of mobility through here and your shoulder wants to come up as you're rolling, don't roll as far. So keep your feet together, and if it means your legs only drop to there before your arm comes off, just go to there, that's okay. Then come back to the middle, and then just go a little bit and come back. And the more mobile you become before that starts to lift, just take it to each bit, and the more mobile you become, the further you'll start to go before your shoulder lifts, and eventually you'll be able to keep that shoulder on the floor as your legs fully drop. So I find as the right shoulder wants to lift a little bit towards the end of dropping to the left, but the left shoulder is quite happy to stay. So something I need to work on is that little bit of right-sided mobility through my lower back, to try and make that a little bit easier. But that's a nice little technique as well. Then technique onto your tummy, a little bit more complicated than the last one. This is called a scorpion. I'm not. I think I might be out of shot by the time you see it, but effectively the top end of my scorpion, I'm just going to be lying like a crucifix, and then you'll be able to see what the bottom half of my body's doing. So again, like the leg drops we've just done, it's just a nice little opener for the lower back. So as you bring your leg up and over, you're just trying to tap ground without your chest coming off the floor too much. Just be careful if you've got any really dodgy back problems, any sort of disc problems, I probably would advise against this exercise. But it's a really, really nice little one for opening up all through the lumbar spine. And then the last thing I want to show you is Shakti mat. Really, really simple. You're just going to lie down on it, and it's quite a nice way to finish. And you can lie on the Shakti mat for up to 10 minutes. Again, just start small and build up. It kind of just depends on your tolerance to it. But you can lie on your tummy, lie on your sides, and lie on your back with it, and it's just really lovely. I have the pillow as well with it, so it's quite nice to be able to just roll down onto the mat and then have the pillow at your head too. And you can just lie there, and it's really nice. You can stretch your legs out if you want the full weight going through it. And it's just a really nice way to finish it all off. Like I say, you can also come up and lie on your side. Definitely not quite as comfortable, mostly because it's quite an underworked area. I find I just really like working through people's ribs and abdominals, so hopefully it's not quite as uncomfortable for those people I treat in those areas. But again, like I say, you can just come and lie on your tummy, and it's just a really nice little acupressure technique to work through all those little myofascial adhesions that build up through too much sitting. So yeah, anyone who has like a low back problem at the moment, I hope some of these techniques will be helpful, and you guys can tune in next week for pelvis and upper leg stuff. So any questions you want to ask, drop me a line and I'll get back to you as soon as I can. So have a lovely weekend. Bye!